How do I get out of a Medicare Advantage plan? If these things are so great, why do people want to get out of them? And why does the government give you so many ways to leave your Medicare Advantage plan? Again, if they're so great, why is this happening? Well, we're going to take a look at that. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute, and I will tell you, I get a number of calls and emails every year from folks saying, well, I can't afford my Medicare plan anymore. And I said, okay, well, how much is your premium? Oh, I don't pay a premium. I just can't afford this thing. And I said, well, if you don't pay a premium, what are you paying for? All these doctor bills and stuff. $300, $400, $500, $600 a month. He said, I'm going to run out of money. Well, unfortunately, that's the way it happens. And without telling you how to get out of a Medicare Advantage plan, because there are half a dozen different ways, and some of them, or maybe none of them, will apply to you. But this year in particular, I've had two people just recently say, well, I want to get out of this plan. And one lady actually called me back in March or so. And she had turned 65 last summer, and friends of hers who were also clients of mine had told her, well, call Bob. He'll tell you, he'll give you the information that you need and help you decide. Well, she decided she'd never call me, and for whatever reason, I don't know, and instead she locked into a Medicare Advantage plan because money was kind of tight. She didn't have, there's no premium in the plan. Plus it had dental benefits and vision benefits and, foot massages and all kinds of stuff. So she decided to go that way. Now this person has had a fair amount of pain for, I guess, a couple of years now because of stenosis in her spine. And so she knew that she was probably going to have to do something fairly soon. And I don't know, who knows why she decided to do what she did, but she did. And so she calls me in March after enrolling last summer in an Advantage plan, and she says, my doctor says I've got to get out of this thing because I'm going to have surgery, and it's just, the insurance company is just giving him fits. First they said you can't do an MRI. And so he fought that for a couple of months, and then they said, well, okay, you can do an MRI now, but don't even think about doing the kind of surgery that you want to do. So, this went back and forth and back and forth. And I had to tell her, well, first off, you cannot change your plan in March. And because you've got pending surgery, nobody's going to take you. So even if you could change it, you can't get a Medicare supplement plan. So anyway, fast forward, and now we're into open enrollment, and she has finally been released from her doctor, and I get more details, and come to find out, because she told me before, she said, no, I'm in perfect health except for this. But I just take some blood pressure medication. Well, okay. Turned out she's got more issues than just blood pressure. And I just said, look, there's really nothing I can do. You're going to have to keep your Medicare Advantage plan, or maybe go with another Advantage plan, but I don't handle those. So there's really nothing I can do for you. I had another lady contact me. They had been living out of the country for a while. And her employer, her husband's employer, said, well, okay, now that you're on Medicare, we're going to put you in this Medicare plan that we've got for everybody. Well, come to find out, that was a Medicare Advantage plan. And so she said, we didn't realize what we had until we got into it. And she said, my husband has to have shots, very expensive shots. They're about $2,000 each, about every 6 weeks. And we didn't realize, how expensive this stuff was, and we have to pay for it. So we want to get a Medicare supplement plan. And I said, well, that's going to be a problem. I said, you're in pretty good health, but it may be a problem for your husband. Let me see what I can do. And so I got some information, and she kept on asking, well, this is open enrollment. Why are you asking me all these questions? And I said, well, because it's open enrollment for Medicare Advantage plans. It's not open enrollment for Medicare supplement plans. For you, that was 6 years ago. And I said, oh, okay. Well, she still didn't. I don't think she still got it. But I said, let's go ahead and see what I can do. And surprise, surprise, I got a carrier to approve her husband at standard rates and said, there's no waivers, there's no exclusions, we'll cover these shots. And so I let her know. I said, okay, well, we got this approved, and so now you don't have to worry about coming up with the money. And she said, well, we'll just keep what we've got. We just don't feel like changing right now. Well, I don't know what the reason was, but anybody who turns down a situation where these shots were given in the doctor's office. So it means once he paid his $200 Part B deductible with the plan we were looking at, he wouldn't have to pay any more for these shots. And so I'm kind of, okay, whatever. It's your plan, lady. Just know that you probably will never have this opportunity again. I don't know how it happened or why it happened, but it did. You've got an offer. She said, I don't want it. Okay. So long story short is these Medicare Advantage plans certainly look great until you get into them and you have what I call your private Benjamin moment where, this isn't the plan I joined. I joined the Army, private Benjamin. I joined the Army with the yachts and the condos. So it's kind of like, no, I'm sorry. This is the way the Medicare Advantage plans really work. And you need to know what you're doing before you sign up for these things, because you may have missed your only opportunity to get original Medicare and a Medicare supplement plan and minimize your out-of-pocket costs for health care. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.